Hello friends, today we have talked about Matthew's Nahai classification. So, flaps classified according to the blood supply, and that is circulation and contiguity and the conformation and the conditioning. Like that, it is 6C, the flap is classified. So, muscle flaps, how classified? So, muscle flap is classified according to blood supply. Coming to the Mathis-Nahai classification. So, Mathis-Nahai classification is dealing with muscle flaps. So, it is classified into 5 types. So, coming to the Mathis-Nahai classification. So, first type 1, type 2, type 3, type 4, type 5. Type 1 having single dominant blood supply, single blood vessel supplying that muscle. Type 2 is the one blood vessel is dominant blood supply, and another small blood vessels is supplying the muscle. And type 3, that is the codominant, two dominant vessels is supplying two portions of the muscle. That both muscles are dominant, that is codominant supply. And type 4 is segmental supply. It is upper portion is supplied by one vessel, middle portion is supplied by one vessel, and inferior portion is supplied by one vessel. Like that, segmental supply is there. Type 5 blood supply. See, the type 5 is one dominant blood supply is there, and multiple segmental blood supplies is also there. So that is one dominant and multiple segmental blood supply is. So these are all the 5 types is described by Mathis and Nahai. So coming to the slides. So Mathis Nahai classification, type 1 muscle. For example, this is the one major vascular pedicle, and example is tensor fascial lata flap. Tensor fascial lata is supplied by lateral circumflex femoral artery. It is the transverse part of lateral circumflex femoral artery supplying the tensor fascial lata muscle. So that is type 1 muscle example. So you see this picture, you know the blood vessel anatomy. Coming to the example, lot of examples is given in the elegant, that is abductor digiti minimi in the hand, abductor pollicis brevis, unconius, colon, deep circumflex iliac artery, first dorsal intraoseous, gastrocnemius, medial and lateral gastrocnemius, genioglossus and ioglosssus, jejunum, longitudinalis linguae, styloglossus, tensor fascial latae, and transversal and verticalis linguae, and vastus lateralis. So these are all the muscles is type 1 muscles. So coming to the type 2 muscles. Type 2 muscles, I already told you, one dominant pedicle and one or two minor pedicles. Okay. So this is one dominant vascular pedicle and minor vascular pedicle. Example, gracilis. The gracilis is supplied by the medius circumflex femoral artery branch. So that is the main blood supply to the gracilis. And also the small branches from deep and superficial femoral artery also contribute to the blood supply. So this is the type 2 muscle. Coming to the other examples, it is a lot of example is there. So abductor digiti minimi, abductor radialis and brachyradialis, thoracobrachialis, flexor digitorum brevis, gracilis, hamstring, peroneus brevis, peroneus longus, platysma, rectus femoris, soleus, sternocleidomastoid, trapezius, triceps, vastus medialis. So these are all some examples. for type 2 muscles. Coming to the type 3 muscles. So I am told type 3 muscles are two codominant vessels, that is two blood vessels supplying upper of one, lower of one, like that. The both is dominant supply. So both is derived from two major blood vessels. Example, gluteus maximus is supplied by superior gluteal artery and inferior upper half, and lower half is supplied by two artery. So for this, we have split the muscle, one half and other half, like that. One half used for plug and other half is kept upright. Okay, so that is the type 3. So what are all the type 3 vascular patterns muscles? That is gluteus maximus, intercostal muscles, and omentum, and orbicularis oris, and pectoralis minor, rectus abdominis, serratus anterior, temporalis. So these are all the muscles having type 3 vascular patterns, two dominant pedicles. So coming to the type 4 muscle, type 4 muscle is segmental blood supply. So multiple segmental vascular pedicle. So segmental means it is segmentally supplied by upper portion, middle portion, and lower portion, like that. Example, sartorius. Sartorius is upper portion is supplied by superficial circumflex iliac artery perforator, and next portion is supplied by the lateral circumflex femoral artery perforators, and other mid portion is supplied by the superficial femoral artery perforators, and in around the knee it is descending genicular artery perforators and superior medial genicular artery perforators supplying the sartorius. So this is the segmental example of segmental supply. So for this example, extensor digitorum longus, extensor hallucis longus, and external oblique, flexor digitorum longus, flexor hallucis longus, and sartorius tibialis anterior is having this pattern of blood supply. Coming to the type 4 muscle, so that is the multiple segmental vascular pedicle. Type 5 muscle, so this is the muscles having single dominant vascular pedicle with multiple secondary segmental vascular pedicle. So example is, so latissimus dorsi is the type 5 muscle. So example, so latissimus dorsi is supplied by the main pedicle is thoracodorsal artery, and segmental pedicle is multiple lumbar arteries. So in this picture, you clearly see thoracodorsal artery is coming above, and it is supplying the muscle all portion of the upper portion. Coming to the lateral portion of the muscle, midline of the portion of the muscle, so that is supplied by lumbar vessels perforator. So this is the type 5. So these are all the classification. What is the type 5 vascular pattern muscles are fibula and internal oblique, latissimus dorsi, and pectoralis major. So this is Matthijs Nahai classification for muscle flaps. So type 1, one dominant vessel, and it is supplying all over the muscle. Type 2 is one dominant, one or two minor pedicle. Type 3 is two dominant vessels, that is codominant. Type 4 is segmental. Type 5 is one dominant, multiple segmental. So first example is type 1 muscle, tensor fasciae lata. Type 2 muscle is the one dominant and two segmental muscle supply, that is gracilis flap. Type 3 is we have two dominant, that is gluteus maximus muscle, and type 4 muscle is segmental supply, that is sartorius. Type 5 muscle is latissimus dorsi. So for this, simply we have to remember this as a mnemonic. So type 1 muscle is tensor fasciae lata. So that is laterally situated in the thigh. And type 2 muscle is gracilis, that is medially situated in the thigh. And type 3 muscle is gluteus maximus, that is posteriorly situated, and sartorius is type 4 muscle, that is segmental supply, that is situated anteriorly. So type 5 muscle is latissimus dorsi. So you remember like this: laterally tensor fasciolata, medially gracilis, posteriorly gluteus maximus, and anteriorly sartorius and latissimus dorsi. So remember like that. I remember like that. You people is there. Set your own memory method. Okay. Thank you.